NEET-PG 2025, outrage doctors demand single shift and fair scoring, raising concerns on behalf of over 2 lakh NEET-PG aspirants. The Indian Medical Association's Junior Doctors Network, or IMA-JDN, has written to Union Health Minister Shri J.P. Nadda, requesting his intervention in the decision to hold the NEET-PG 2025 examination in 2 shifts. In their respectfully worded letter, the doctors point out that while the 2-shift model was reluctantly adopted in 2024 due to last-minute rescheduling and security arrangements for more than 2 likely candidates, no such logistical emergency exists this year to justify splitting the exam. According to the National Board of Examinations in Medical Sciences, or NBEMS, NEET-PG 2025 will be conducted on June 15th in a morning session from 9 o'clock in the morning to 12:30 in the afternoon, and an afternoon session from 3:30 to 7 in the evening. The IMA-JDN argues that with ample lead time for center allocation and established security protocols already in place, there is no operational need for double shifts, and that reverting to a single session would alleviate significant stress for aspirants. A primary grievance highlighted in the letter pertains to the opaque normalization process used to equate scores between the 2 sessions. Last year, many candidates who sat the afternoon paper reported that it was markedly more difficult than the morning paper, yet the formula employed failed to adequately adjust for this disparity. The result, they contend, was not only unfair scoring but also unpredictable rank outcomes, which undermined morale and eroded confidence in the examination's integrity. Compounding this lack of transparency, aspirants remain unable to access their own answer keys or response sheets, nor are they permitted to challenge potential discrepancies. Despite thousands of emails and formal representations to both the NBEMS and the National Medical Commission, or NMC, candidates say they have received no substantive replies, leaving them anxious and disenfranchised. A recent Shiksha.com poll underscores the depth of discontent. 89% of respondents opposed the 2-shift format for NEET-PG 2025, while just 9% supported it and 2% remained undecided. Such overwhelming opposition, the IMA-JDN argues, should prompt policymakers to reconsider their current plan. Dr. Indranil Deshmukh, National Secretary of the IMA-JDN Standing Committee, emphasizes that the lack of transparency in the normalization process, unequal difficulty levels across shifts, and denial of access to answer keys and response sheets have raised genuine concerns among candidates regarding the fairness of the process. He urges authorities to conduct the exam in a single shift, to publish detailed score calculation methodologies, and to expand computer-based test centers to every district. With just months remaining before the scheduled exam date, aspirants, and now their representative doctors, await the ministry's response. Will the health minister step in to mandate a single-shift NEET-PG, or will the NBEMS proceed as planned? As the debate continues, the future of NEET-PG's fairness and credibility hangs in the balance.